Hi, this is Doug Slakey talking about process. When it comes to healthcare system process design, the conventional approach uses linear systems or process theory. This makes sense. Linear processes are easy to understand and predictable. For administrators and leaders, they're easy to map out and implement. It's relatively easy to align performance incentives and targets with linear processes. When something goes wrong, we can find out where the process broke down and sometimes who to blame. A linear system follows the principles of homogeneity and predictability, meaning that for a given input, like a patient with a specific diagnosis, the system should produce a predictable result. But healthcare is not a linear system. Every patient is unique, shaped by their history, genetics, and socioeconomic factors. Variability is the norm, making it far more complex than a simple assembly line. That is why reductionist linear system theory falls short when applied to healthcare. The inherent complexity and unpredictability of healthcare don't fit the rigid assumptions of a linear process. Systems can also be categorized as complicated or complex. Complicated systems, like a car engine or a computer network, have many interdependent parts that tend to behave predictably. Although more challenging to manage than linear systems, we can still predict the results of a complicated system most of the time. Now let's dive into complex systems. They comprise many elements that interact dynamically, leading to unpredictable behaviors. Complex systems are by definition nonlinear, meaning they're not always predictable. Emergence leads to unexpected outcomes when elements interact. In complex systems, the components are interdependent, and we cannot isolate one piece of the system and expect it to function independently. Think of a patient journey and how many different parts of the system a patient encounters. Due to complexity, two patients, even with the same diagnosis, may have very different patient journeys as they receive their care. In complex systems, rigid control doesn't work. Resiliency is needed. This allows systems to adapt to the unexpected, maintaining process flow even when disruptions occur. Adaptation is crucial because complex systems change their behavior in response to environmental shifts. Optimizing complex system management means delegating authority to where the patient care occurs. Empowering professionals is crucial to optimizing patient outcomes. And how do we empower healthcare providers? By ensuring they have training and skill necessary, that resources are aligned and available to meet patient needs, and that actionable information is available. We also have to align incentives with patient-centric outcomes. The best patient-centric care occurs when the system can respond quickly, decisively, and authoritatively at the point of care delivery. In healthcare, it's essential to recognize that linear system approach typically falls short. Complexity requires resilience, adaptation, and trust in the professionals who we rely on to navigate this intricate world and give each patient the care they deserve. With processes that work, we can solve many of the healthcare challenges we face with respect and compassion. For more information, click the link in the comments and look for the release of my book next month.